Okay, so I just started recording this now. So I'll go through some of the letters. If you've got any questions, you can either type in the chat box here, or you can raise your hand. I can turn your microphone on, and we'll see how that works out. Okay. You can't, well, that's your settings. There's nothing wrong at this end. Everybody else can hear me. What you have to do, go down to the bottom left of the screen. You'll see a microphone button, an icon. And if you click on it, it will give you a list of microphones and speakers. Okay. Your microphone seems to have come on now. So there's a drop down menu and you can choose your microphone and speaker. Is it working now? Yeah? Is it working now? Yeah. Okay, so it's just a settings issue. It's just a settings issue. Anyway, so I'll do a screen share and I'll put the files in the library on Easy Class. And I'll put this video on YouTube onto my channel so you can watch it later. Anyway, so as I said, you can either type your question into the chat box or you can raise your hand and I'll turn your microphone on. So let me turn that off. Screen share on. Right. Can you see this letter? Can you see it? Yeah? So let me save the changes. See what we've got here. Record. So I think I've seen this before. What do we have to do? Write a referral letter to Dr. Smith, endocrinologist, for management of Mrs. Sharma's sugar levels. Refer to specialists for further management. So that's our task. That's what we've got to do. Further management of sugar levels. Let's have a quick look. 40 years, 3 adult kids, for granted, okay, irrelevant, don't need that. Men, relatives with type 2 diabetes could be significant, but not necessarily, because the task is to manage her sugar levels. We already know that she's a diabetic, so it doesn't really matter about that family history. Never smokes, no alcohol, no exercise, irrelevant as to what you want them to do. So good diet, smells nice, is normal. Sugar levels, what's this? Full exam, medication. Okay, that seems pretty straightforward. You just want the endocrinologist to help Mrs. Sharma to manage her sugar, and that's it. Okay. Writing to request your third assessment and management of Mrs. Sharma's symptoms of poorly controlled blood sugar, type 2 diabetes, mellitus. Okay, well, yeah, that's not too bad. I don't really know if we need all this about her signs and symptoms. We know what the issue is. It's not as if she's trying to ask you for a diagnosis. We know what it is. All we want you, well, the reader, to do is to manage it. That's basically it. Okay, but that's not too bad though. We've got a relative clause. Okay, but we don't really need one here because we know what the issue is. Further assessment and management. Well, we don't want you to assess her. Not really. We've told you what the issue is. Further management. There's no need for assessment. I'm telling you what is wrong. You don't have to ask. We want you to do a particular task, and that's it. So we don't really need that. Manage her sugar, and that's it. Okay. But, you know, that's not too bad. We've got a relative clause. You write it out first, and you've got an acronym. Okay, sorry, abbreviation. So initially, Mrs Sharma presented to me. Presented to who? Me. Complaining of much blood sugar levels, background diet, and themes of medication, levels were fluctuating. Okay, that's good. Therefore, she was required and blood test article and a blood test or blood tests. Now, it depends. If it is a singular test, we need an indefinite article because it is singular. If we're talking about blood tests in general terms, then you need to make it a plural. So presumably it's only one, but her tests. So it's either a blood test or blood tests were requested. Okay, so either one of those, but not blood test. 2 weeks later, her tests result, or her test results. Now, right, we usually put the plural on this word here. Her test results, or her tests results, but it's the results of her test. So put your plural there. Revealed elevated HbA1c, 10% GFR. I would spell that out a little bit. Subsequently, she was commenced. Metformin dose was decreased to 1 tablet at night. On a subsequent visit, she reported improvement conditions of lipid profile and fasting tests were requested for review. Histology results revealed normal lipid profile, fasting blood sugar. Mentioning medical history. Now at least we haven't included any of the irrelevance. Okay. Has had since 1994. Yeah, good. Present perfect with your adverb since, so that's good grammar. Worth mentioning. It's worth mentioning. I don't know. It's worth mentioning. You just say, please note that. Worth mentioning as an expression. You know, I've seen this, but I wouldn't use it personally. I would just say, please note that. That's fine. Not it's worth kind of mentioning, but it's not down. I don't like that as an expression. Just say, please note. In view of the above, referring for assessment and management regarding your sugar levels, well, it's not regarding, you want help in, what does it say exactly? Management of the sugar. So further assessment and management of her sugar levels. And further assessment, well, you can include it, but it doesn't strictly say that. It says, can you manage her sugar? Give her some plan to manage her sugar. You don't have to assess her. Okay, but that aside, that's not bad. Now, I'm just going to check the word count, because it looks a little bit long. I want to see what we've got. 244. Okay, that's a little bit long, but there's a lot of detail here. You've put all these medications and this dose and that dose and this dose. You could probably lose a few words here and there in that paragraph and that one. But 244 words, it doesn't make a lot of difference. It's only a guideline, and you haven't included any irrelevance, which is one of the dangers of writing too much. We often see people include stuff that we don't actually need, so that's not so bad. Not bad. Okay, what do we have here? It seems you're writing exactly the same. It's just like a script. Writing to request your further assessment and management whose signs and symptoms are consistent. Isn't that exactly the same? Well, it's pretty close. You keep using the same expressions, further assessment and management. It doesn't want you to do that. Signs and symptoms are consistent. Well, yeah, they are consistent because that's what she's got. You don't have to say this, she's got diabetes. Yes, we already know this. You have diagnosed this. What you want them to do is to help her to manage her sugar levels. So you don't really need all this. Oh, what is this? Do we need this? Do we need this? She's married and she's got 3 kids. Having 3 children? No. Do we really need this? No, not as such. She's been a known patient of type 2. You mean she's been a diabetic since 1994? Worth mentioning these expressions again. You keep copying and using the same expressions every time. Nobody is going to get an A because you keep copying the same expressions every time. It's not original. It's the same expressions. She has a strong family history of diabetes. Okay. Initially, Mrs Sharma, what to me? Came to me? Presented? We need a verb. With a concern. So she was concerned. A concern? Regarding uncontrolled sugar levels. Came to me about, or regarding, or she was concerned. Her examination was unremarkable and some blood tests. Okay, now that's good. Active. I like to see a bit of active. You know, in some of these letters, there's too much passive. This was commenced, that was started. Don't you as a doctor actually do anything actively? Is it always passive, passive, passive? Doesn't seem so. So that's good. Okay. Her result showed elevated cholesterol. She was commenced, was decreased. Thought I saw that. Is this the same person? Now you've got to watch it. What does it say here? Because if you're not paraphrasing, okay. So it's not straight from the notes. Okay. Unremarkable. On a subsequent visit, she reported that an improvement. She reported that. Why do we have that? Why do we have a relative pronoun there? Moreover, subsequent visit. Why isn't this separate? It's a separate visit, isn't it? Okay. Right, so either she reported that her condition had improved or she reported an improvement of her condition. So if you insist on using the relative pronoun, we would have to do it like this. She reported that, because it's reported speech, essentially. Okay, yeah. So this is essentially reported speech. Oops. So she reported that her condition had improved, yeah. Reported speech, or she reported an improvement of her condition. So it's either this one or this one, but not reported that an improvement. Okay, so watch your grammar. If you're doing reported speech, you've got to do it like that. Your pronoun changes, your main verb goes into the past, etc. Okay. Pathology results revealed normal profile, so blood sugars were normal. Hence, now, hence means like therefore, as a consequence of, but you mean and her other blood. So how can you apply hence as a consequence of therefore when there's nothing to say? You know, you're not making a comparison. You're not showing a cause and effect. Other blood sugars were normal in range, so we wouldn't use that. Pathology results with and don't need hence. In view of the above, I'm finished patient chief with valuable opinion as opposed to your completely worthless opinion. Why would you say that? You know, you don't have to lick, I don't want to be overly crude, but you don't have to lick the specialist's arse. You know, your valuable opinion, I would highly appreciate it. The medical professionals doing what they get paid for, doing their job. You don't have to, you know, as opposed to what? Their worthless opinion. And you don't want an opinion. What does it say? Back to the case notes. Right, can you manage her sugar? Refer to specialist for management. We don't want an opinion, you know. We're not asking for this. We want you to manage. That's it. Okay. Further comprehensive management regarding her high blood sugars. You mean the high blood sugar levels. Okay, not so bad, not so bad. But it's still a bit of rephrasing on some of those sentences. Let's have a look. 244, again, a little long. You can maybe cut some of these things out. Use conjunctions, combine some sentences, but still not too bad. Okay, I'd like to do a question for assessment and management. Have you been reading this from the same script? Because you're all writing exactly the same thing. Exactly the same thing. It's like a copy and paste job. Right, in response to Marianne's question, should I read doses and values? It depends if it's important or if the exact dosage and value is particularly important, include it. If it's not specifically important, but you need to say that something increased or was reduced, then you can use those two verbs. Mr. Gitwas got a question here. Is there any other separate sessions for how to write a letter apart from letter correction? What do you mean? You mean how exactly, starting right from the start, phrase by phrase, word by word? Nobody's asked me. No one's asked me. Everybody's just sending letters. Can you evaluate this? Can you assess that? You know, that, etc. I don't know if anybody wants such a session or what format it might take or when it might be. You can make some requests on Telegram and we'll see what we can do. So my teaching question for assessment and management of signs and symptoms are consistent with uncontrolled blood sugars. Okay. The same as everybody else. Have you noticed this? Everybody's introduction is identical. It's almost as though you copied it from somewhere. Okay. You know, if we were doing the IELTS test, for example, or I was a university professor and I saw everybody writing exactly the same introductions, you would all get marked down. I mean it. You'd all get marked down. However, let's continue. She presented to me with concern. Now, I would mention her name at first and then use, you know, she, her. Then initially, Mrs Sharma presented to me with a concern regarding unstable sugar level. So her, unstable, don't forget your pronouns, or it could mean unstable sugar level or levels, I think, because it's an abstract in general. Examination was unremarkable, apart from a significant blood pressure, therefore I ordered some blood tests. Good. Active voice, please use it. It doesn't always have to be passive. And so therefore I ordered some blood tests and prescribed Atacan. You can mix active and passive in a sentence, but you know, why? If you're doing a parallel structure, should both be active. I ordered some blood tests and prescribed and in addition. If you start active, why not continue? Okay. 2 weeks later, her results showed elevated HbA1c, cholesterol 6, Forethought reason. What do you mean? For that reason or for this reason? Because that doesn't make sense. For that reason, she was commenced. She was right now. Usually these verbs would use some kind of a preposition. You commence on, commence with, you know, commence at, not simply verb and noun. You usually have some preposition. She was commenced on, or now how most people do it, right? They put the noun like that, yeah, and they say something like Lipitor was commenced, yeah. So if you're using a pronoun like that, then I would put a preposition, she was commenced on. Okay, so you can either do it the first way around like this. Okay, Lipitor was commenced, or if you've got your pronoun, she was commenced on, and use the noun. Okay. Okay, after which you put in a condition, so the period, profile, lasting result tests were requested, the result revealed, elevate. Right, so again, so we've got, right, her result revealed, elevated of her. So, again, word order, it's either her results revealed her fasting blood sugar level was elevated, or an elevation. So make it a noun. So I'll type these out. Right, so either her results revealed an elevation of her fasting blood sugar, blah, 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 or revealed right, so either one of those two, right? The one that you've used doesn't work, okay? So, if you're going to make it a verb, elevated, her results revealed her fasting blood sugar either was elevated or had been elevated. I think was is better. Or make it a noun. Her results revealed an elevation of her fasting blood sugar. Okay, so if you're going to make it a verb, do it like that. If you're going to make it a noun, do it like that with an article. Okay, in view of the above, requested your further assessment and management of Mrs Sharma's possessive condition. Okay, if there should be any other queries, please don't hesitate to contact me. So what's your word order? If it's a verb, do it like that. If it's a noun form, do it like that. Okay. So, a few changes there. Check the word countage. 182. 182. Let's have a look. 195. Okay. Okay, it's not too bad. It's a little bit short, but it's within the recommended range, so that will be fine. Okay, what do we have here? Another one. Hang on, I've seen this introduction. Why do you all write exactly the same introductions? Is there some reason? Your further assessment of management as Mrs. Features, whose features are consistent. Okay, initially she presented reporting concern right. We've got, what's it? So we've got one verb here, we've got another verb here. Reporting concern regarding. So she presented complaining, or she presented showing concern, or simply regarding. You know, you don't have to use that. You can simply say she presented regarding her, because if it's abnormal, then naturally she's a bit concerned because it's not normal. So you could simply say she presented regarding her abnormal glucose levels. Yeah. On examination, high BP was shown. Was shown. On examination, she had. Passive, passive, passive. Why is it all passive? High BP was shown. On examination, she had high BP. Blood pressure. Now, why? Oh, 10 minutes left. So, why is all these abbreviations? You should write it out so it doesn't look like notes. Okay, therefore, were ordered. Furthermore, why is it furthermore? Why didn't you just add that, make it part of a sentence? Okay, 1 week later, investigations revealed elevated levels. Subsequently, those was changed from tablet. So what's it mine? Whom? Whom? Isn't whom a person? An object? Whom? Blood tests were ordered in late January, which results were reviewed with the patient January, and the results were reviewed with the patient on today's consultation. High fasting blood glucose was shown in spite of taking the medications. Well, you could have made that part of a sentence. Now, right, it's usually good when you're writing a sentence that doesn't have any obvious connection with the previous sentences to have some kind of introductory gambit or expression, something like regarding her social, you know, so people, instead of dropping in this Mrs. Sharma has been blah, 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 you need to introduce it first. Yeah, so regarding her social and medical history, that's a phrase that you can use in a social and medical history, or you can say like, please note, or for your information, you know, so have some introductory expression before simply dropping in a sentence. History of type 2 DM. So abbreviations, acronyms, you need to spell those out. View of the above, take care for ongoing control. Okay, that's not so bad, not so bad. What's this last one here? Looking to refer for further management. Mrs. Sharma, who was demonstrated sensitive consistent with uncontrolled DM. I would spell that out. Medical history, she would diagnose. Oh, I shouldn't laugh, but she's got a good appetite, really. And I need to know this immediately, right at the start of a letter, because what? I don't think we need that right at the start. Not really. So, Mrs. Sharma presented concerning, oh dear, right, presented concerning of, presented concerning her uncontrolled DM, because she checked several times her, oh dear, right. She checked several times the sugar level. We don't really need that. Presented concerning her uncontrolled DM and spell it out. Okay, because she checked several times. Well, of course she checked, because if she hadn't checked, then she wouldn't know there was something wrong. So we don't really need to state the obvious, which was between 6 and 18 recently. Consequently, although at that time physical examination was normal. Mrs Sharma's pathology report reveals, I should spell all this out, too many. And don't do that, because that just looks like it's been copied straight from the case notes, and we don't like that. We don't like it. You're not supposed to copy straight from, you're supposed to write complete sentences. If you do this kind of thing, you'll get marked down accordingly, because it's not a complete sentence. Their forming regime was changed. Was added one main. Today, make it capital. Mrs Sharma returned his receipt with a history of. Well, a history, what you mean since the last time? You don't usually use this except for the first time, or if there's been some significant gap between when you saw her the first time or last time. Oops. Let me just have some tea. So I wouldn't use that. If you take note of how the previous letters showed a timeline, a chronology, yeah, that's what I would try and copy. I wouldn't use that, except that's usually the first paragraph. Okay, weapons investigation, film in terms of blood sugar level. Okay, not so bad. So looks a bit like notes. You want to change that. Spell this out again. It looks like notes. Supposed to be writing proper sentences. Don't really need that. Okay. 4 minutes. I should just have time to have a look at this woman. Now, okay, you've spelt it out. That's good. Okay, and you see, it doesn't all have to be exactly the same like everybody else. I'm writing to refer, what is it? So that's introduction virtually identical as that introduction, identical as that introduction, identical. You see, you don't have to do that. You can show originality, like, refer this patient. Okay, good. In terms of the medical history, now that's good, right? Nice and clear, concise, to the point. None of this about appetite. Okay, initially presented regarding her concern. That's good expression. Regarding her concerns due to uncontrolled blood glucose levels, the examination was unremarkable. High blood pressure. That's a drug regime. Multiple lab tests. Instead of this is pretty good. You should all note, pay attention. This one's good, very good. This is the difference between B and A, if you care about that. Not to says what orders on review to its fatal results revealing people BT. She made good progress. Don't need the article. That's very good. Excellent. Very good. Very good work, Dr. Shaheen. Very good. I commend this. I commend this example. It's pretty good. You can see originality, right? Not writing the same shit, the same expressions that you've copied from 1,000 others, right? We've got some original use of English. The grammar is pretty good. It's concise, to the point. Some good stuff here. So I recommend this one. I commend this particular letter. Excellent. So, it seems the best was saved till last, it seems. Very good. Right, we've only got about a minute left. So I'll be on Telegram for the next 10 minutes before my next lesson to answer any questions. Okay, so this last one here, I would take a look at it. It is quite good, quite good. Very good. Just one thing, don't need the article there. So I'll be back on Telegram for the next 10 minutes or so. If you've got any questions, I'll turn this off here. I'll put the corrected files in the group. I'll put the video on YouTube shortly, and I'll see you there. Okay.